There we are.
Hi, this is Gemma from ASD Rocks, just sitting here with Phillip Bliss, dentist of the stars being my two younger children, Bo and Finn, and wanting to get a professional opinion in regards to treating children with ASD. Phillip, you've had some experience treating obviously my son and
Indeed, and many others.
And many others. So how long have you been a dentist?
I hate to say it, but it's 47 going on 48 years.
48 years. So you've had some experience probably with people who, prior to when autism and ASD was even a diagnosis.
Absolutely.
Yeah.
Yes. I mean, they were just treated as very difficult children, very difficult patients, but
Yeah.
there was not the labelling at that stage.
So it must be difficult being a dentist. With most people, they have a fear, let alone with children or adults who have ASD.
Not necessarily. It's very interesting, more and more nowadays, because dentistry has become much easier. Treatments become far less invasive. A lot of dentistry nowadays is just not painful, it's just straightforward. Probably the bigger problems, and I think this runs through whether patients have a disability or not, is that a lot of fear and a lot of concern about going to the dentist is transmitted mainly through mothers who have had bad experience in the past. So basically,
As many fears are passed on to our children.
absolutely, but particularly when it comes to dental, a lot of parents and most kids come with their mums, but it's how mothers talk to their children about coming to the dentist. It's the words used. It's the body language, it's the over-concerning, sort of trying to cuddle, when very often left to their own devices, most children can be perfectly normal.
So in
Be
fact,
fine.
you could set your child up for success or failure just in the way.
Before you walk through the door.
Yeah.
And that's actually a major problem and a major factor in how all the rest of it goes. In many respects, well, I know I have, and I think probably a number of other dentists do, you treat every child patient as though they had problems and disabilities until proven otherwise. And I mean, it was like 30, 40 years ago when we were treating patients with AIDS. You had to, in the early days, you had to predict who did, who didn't. Now you treat everybody as if they had AIDS.
I understand.
So with children, there is such a variation, such a huge, literally, spectrum, that some children with known autism can often be much better behaved and much more cooperative than
a spoiled brat.
Absolutely.
And we talk about that a lot in ASD Rocks. We talk about disciplining your child. Are you disciplining an autistic behaviour, or are you disciplining a child that's being just a brat, and
Yep.
being able to choose between, as well as setting up your children for success. We start, for example, with Bo now going to his new high school, we started that 6 months prior.
Absolutely.
So I'm going to start with a few basic questions, really basic questions for people who, maybe from others who have had bad experiences, or people who really haven't had mothers who didn't have mothers that took them, so that we can really sort of help that educational process about how important it is. What is the real difference between kids' toothpaste and adult toothpaste?
Okay. So most toothpastes are made to a certain standard. Adult children, the main difference between adult toothpaste and children's toothpastes is actually the flavouring. And most adult toothpastes are too strong in taste for children. And that's the main difference, the main subtle difference. Most toothpastes have fluoride in them. The toothpaste is a vehicle to get the toothbrush around the teeth and to make a pleasant flavour in your mouth. By introducing adult toothpaste at an early stage can be very off-putting for children because it's a lot of the mints are just too strong.
So if toothpaste is really a vehicle to get that toothbrush around that mouth, if you have a child with a specific, for example, ASD children become very systematic.
Yep.
And they won't want to move on, if they continue using a children's toothpaste for the rest of their life, there's no problem with that.
Heavens no.
No?
Absolutely.
And what about if you have a child who has a particular oral sensitivity to textures? What about just using the toothbrush and water? It's still better than nothing, or?
Look, the effectiveness of cleaning your teeth is much more dependent on the toothbrush than the toothpaste. So just using a toothbrush and water is fine. Having a toothpaste there of some description, and you can really get some very bland toothpastes. It just breaks down the surface tension on the teeth to be able to clean away the plaque, the film that contains the sugars and the materials that can damage the teeth and the gum. Did
you see they made those finger and you could just do that?
They use it for dogs as well.
If you have a child that is specifically sensitive to textures, toothpastes, not the toothbrush, could you get away with that sort of thing as well?
Absolutely. Look, anything that gets in that the patient will agree to and not be put off by, go for it. Fantastic. And that's really the bottom line. You'll see a lot of advertising stuff that this is 8 times better than that one and blah blah blah. You've got to be able to get it in the patient's mouth. And if you can't get it in the patient's mouth, you may as well leave it in the tube and not use it. Just using sodium bicarbonate just as a little paste, which is very bland, is great, is terrific.
Yeah.
And doing it with your finger actually has 2 benefits. One is that, and I often recommend this to adult patients when they have gum problems, that by putting toothpaste on your finger and massaging it around the sort of neck of the teeth all the way round, you can actually feel where you're getting to. And so can parents feel where they're getting to. A lot of the problems that arise in oral health issues is that nearly everybody has an area that they always miss because you're distant. You've got a toothbrush that gives you that awareness. So by using your finger, you're right on it and you can massage the gum. And with a lot of autistic children, that stimulus is actually a lovely, soothing, relaxing procedure. So it has 2 benefits. And some autistic children love electric toothbrushes where there's a bit of vibration. They love that vibration. So go for it. I think in all these sort of things, the bottom line is always, if you can get in there and clean, whatever you have to do it is well worth the experimentation, and obviously not one thing fits all.
Okay. what age do you suggest a child start? When do we start brushing their teeth? Actually, what age do we start worrying about that sort of thing?
The earlier the better. So the sooner you get children into a habit, the better.
Teeth?
Absolutely,
Two
absolutely. If children know that in the morning and at night before they go to bed there's a ritual that they have to go through, the earlier that's burned in, that this is what happens, the earlier the better. So as soon as teeth appear, and it's amazing how that becomes in their own way a ritual. Now they may use that at odd times to delay going to bed. I haven't cleaned my teeth, so you have to get up. But
someone's got children.
Absolutely, but you can sort of travel with that. That's great. If it's left too long and they're too old, it just becomes more difficult. And it's the same going to the dentist. I always have recommended parents to bring their children along, and what we've always done is to let them play with some toys in the corner of the surgery. They see that mum and dad survive. At the end of the appointment, we get them to sit on mum or dad's knees. We bring them back, we have a quick look, and once we've got the child relaxed and we've been able to just clean 2 teeth with a handpiece and a little brush, once we've been able to do that, 95% of the time they are then set for life. It's all comes down to trust, and for the child to know that they're in a safe environment, and of course lying on mum or dad's chest, you can't get any more safe than that. But very often the next time in, or it might take 3 visits, they come in and they want to be on their own and have it done without mum or dad there. That is by far the biggest secret to successful future dentistry. Even when they have a perfect mouth and they've got a perfect diet, you never know when they might fall over and need emergency treatment. If that treatment is the first experience that they get, it's a problem. It's a real problem. If they've been coming for a year or 2 and they know the environment, they know the nurses in the different uniforms, they've sat on the chair already, it's a big deal.
And I remember right at the very beginning bringing my children to you and them just going for a ride on the chair, not even...
And you.
And me, I know. Philip has been my dentist since I was born, literally. So it was easy for me to ask and request for my children to come in. But I do believe that most dentists, especially if you do explain the situation, will be happy to have the child just come in and take a ride on a chair.
Absolutely.
Because they also want to set up a future success.
Absolutely, without question.
So this is an interesting question I have for you. There are, and I've met a wide variety of parents, and obviously having had Beau diagnosed at the age of 2, where now, he's 13. There are some parents that have chosen not to tell their children that they have ASD for whatever reason it is. They don't want them to feel that they are misfits, whatever their reasons are, and I'm sure they're valid, whatever they happen to be. However, if they pull you aside and they tell you, does that make a difference to you? Is it easier for you to know what you're dealing with rather than having to work it out yourself?
Absolutely. I mean, with any issue that might affect the relationship or how treatment's done or how you treat a patient, it's really important to know all the medical history, whether the parents think that may or may not be relevant. because sometimes it's very relevant.
And you'd keep the confidentiality from the child if the parent said that child didn't know.
Of course.
But it would make a difference. Okay. So how do you think your approach changes if you do know, if someone rings up or if someone's coming in and you know you're treating a child with ASD? You can take even my children, Finn being so much like me and so easy to treat, and he's sitting there and he's so excited to be at the dentist, and we've got thumbs up. How do you think your approach changes in your mind knowing that you're about to treat a child that has ASD? What do you think you do differently?
I think the bottom line, and I go back to the very beginning of this conversation, it's the same reaction that I get to any new patient and certainly any new child. You never know quite what you're in for, what that relationship's going to be, how the child's going to react. And the bottom line again is you need a bit of time so that you don't have to rush. You can deal with things and be prepared that maybe that day Georgie's having a bad day. So you do what you can, but you don't push it. It's not a win. I've got to win this. It's trying to draw the child into a relationship where they trust you and believe what you say is what you're going to do. It matters to know that the child has a various complaint of whatever that is, but you still deal with that by slowly introducing the patient into the next procedure. It's very much a show and tell. This is what we're going to do, feel it, let me play with that on your finger, and you then move to the next stage and the next stage. You do that with every patient who's new, not an adult, but every patient that's a child that's never been to the dentist before.
And that's definitely so. I know that there have been times, because I am so au fait with the dentist, that I have brought Beau in and he's had, one tooth hanging by near one root, and I sort of say to you, just give it a yank, and I'm not going to betray that trust in him. And I think that shows that, you really do work on a trust basis with that child, because I would have just said, it's nearly, come on, it's so easy. And you know what? It'll fall out on its own. Let it do its thing. So it's great that you can veto the parent in some way when it comes to that, because I would have just got
it can then break down that relationship, and you really almost have to start all over again the next time they come in. It's not worth it.
Yeah. What is the risk to teeth if the ASD is what a parent would consider so bad that a parent deems it impossible to go to the dentist, and just, ASD parents will always talk about, I've given up on that fight. For example, Beau with his food. He has these foods. I'm still trying a little bit, but in all honesty, he's getting what he needs, and I choose my battles. What is the danger or the risk to the child or the teeth if this is a battle they give up on?
Yeah, I mean, there's levels. There's certain levels. By not doing anything would be a disaster. If there are cavities developing at some stage, those cavities will cause tremendous problems, infections, and a lot of unnecessary pain and discomfort. And of course, if nothing else works, you have to do some form of sedation or general anaesthetic. So deciding that dentistry is just too hard and putting it in the too hard basket and saying, you know what,
never going to take this kid to the dentist. That's not an option.
Well, it shouldn't be, because you're doing your child a great disservice, and it doesn't gain anything. It doesn't solve anything. It just because you can't see it doesn't mean things aren't happening.
What sort of problems can arise from not seeing a dentist?
Basically, three things. One is you can have a developmental issue that's forming that very often nowadays can be resolved. By that I mean the way the teeth are biting and coming through space, whatever. Very often that can be sorted out in early years rather than later on. Obviously you can get holes developing, which, as I said, will develop. They'll only get bigger, and they will start causing pain, and then they can become infected. If they're baby teeth, they will eventually be replaced, but losing baby teeth early creates a future crowding problem, because the space will get lost for the other adult teeth to come through. So by maintaining the baby teeth where they are and the size of them, makes it much easier for future adult teeth to erupt, so that you have a larger area for the adult teeth to come into. So it's multifactorial, but it's and sometimes with a patient with really good cleaning, really strong teeth, really good diet, they might not need anything, and that's not an uncommon thing nowadays. But who knows till you have a look?
Right.
Who knows till you can get a record over a year or two to see.
And worst case scenario, as they go into their teen years and into their adulthood and have never been to a dentist, and they have these problems and have never had them seen to, what sort of, you talk about infections, those teeth may I assume fall out eventually. No, not
necessarily. I mean, they can stay there, become the source of big infections, and then you do definitely need a general anaesthetic to extract them, and that's so unnecessary for most children.
And those infections can spread to further than just the jaw, can't
Absolutely,
they?
Absolutely. And if that affects, if that is the same situation with adult teeth, with the permanent teeth, you're losing teeth that you need for later on, for aesthetics, for eating, for speech, for all the issues that can affect the patient socially, and that's a very big factor. The last thing you want is for a child to have other issues, and when they open their mouth and smile, it looks terrible. So you've got a psychological side to it, you've got a physical side to it, and very much you've got an emotional side to it.
And also, I think these children are already battling as much as it is to make connections with other people. When they do open their mouth to speak, and their speech is they have an impediment due to the fact that they have lost teeth or have infections and whatnot. We live in a society, unfortunately, where we do judge on looks, and this is absolutely not about let's make children aesthetically pleasing for other people. We all know that our ASD kids, I've made a video on this already about dressing them in cool clothes, help them fit in, try to help them fit in with their dentistry as well. So, all right, well, thank you so much. I really, really appreciate it. I really do.
Okay.
Because, and in fact, I know I'm going to be bombarded with questions I'm going to be emailing you with.
Well, I'll be more than delighted to answer them. And I don't know, maybe if there are a lot of other questions, we'll do another session
That would
in a
be
few
great.
weeks, and we can answer and go through those issues.
Well, I'm going, if it's okay with you, I'm going to bring my camera in with Bo next in May when he's due, and we'll just film the session about how comfortable he is with you now, because he does trust you so much, and there is a lot going on in that mouth of his
Absolutely.
right now. All right, thank you so much.
My pleasure.
Thank you.
Bye.
Bye.